Sir.
Yes, ma'am. Sound is audible, ma'am. Your sound is I am not listening.
Can you hear me now? Hello? Hello? Good afternoon, sir.
Yes, ma'am. Hello.
Sir, can you
May I
hear
audible?
me? Yes, you are audible.
Your
can you
voice
hear
I
me,
am
sir?
not hearing, ma'am. Unmute your mic, ma'am.
Hello, can you hear me, sir?
Unmute your mic.
Hello? Hello?
Yes, ma'am.
Can you hear me?
May I audible?
Yes, you are audible. May I audible to you?
कौतुक को यूट्यूब पर देखो मेरा वॉइस आ रहा है क्लिक करो उसको ऑडिबल नो आ रहा है ना यस मैम
You are audible. Can you hear me? Can you hear me? Sir, we go.
Hello.
yes ma'am yeah
Sir, can you hear me?
yes ma'am I can hear you
Yes. Okay, okay. Audience. Welcome back after lunch break with the spirit of the show must go on. It will be a privilege for me to invite Dr. Professor Sanjay Sinde sir on stream at topic on method of data collection. I invite Dr. Sanjay Sinde sir proceed on streamline.
Thank you, ma'am. First of all, thank you, Dr. Subhash University School of Nursing, especially Professor Sevanti ma'am, for given me opportunity to present this topic. So please share slide, sir. Slideshow. Keep on slideshow mode. So today we'll discuss about Maya audible, ma'am. May I audible, ma'am? Hello. So types of data and data collection techniques we are using in the research. Hello, ma'am. May I audible? Yes, ma'am. Next slide. So the word data is a plural form of the word data, which means the information that is systematically collected in the course of the study. So without data, we cannot do the work, this one research or analysis. So the tool is very essential for the work, the research. The data are observable and measurable facts that provide information about phenomenon under study. So the data collection is the process by which the researcher collects the information answer the research problem. So, madam, audible, no? Okay, ma'am. Okay. Okay, okay.
For misinterruption. So data collection is the what process by which the researcher collect the information needed to what answer the research problem. Means to collect this one the data tool for the what for research to collect the information to needed the what answer the research problem. So next one, next slide. Method and tool of data collection. So you are using different method of the what data collection in the research, the various steps, strategy used for what gathering, analyzing the data in a research investigation. So you'll call as a method of data collection. Means both you are using what different types of the what data collection. Next slide. So techniques of data collection means to means of gathering the data with the use of specific tool that are used in given method. So known as techniques of what data collection means we are using different method of the what data collection. So next one, tool for data collection means it is a research instrument is a device used to measure the concept of interest in a research project that researcher uses to what collect the data. So we'll call as a tool for data collection. So next we'll see what are the different types of tools we are using for the what data collection. So in that first one, you are using interview method, interview schedule, and opinion. The next one you are using questionnaire method, questionnaire, opinion, attitude scale, Likert scale, visual analogy scale. The next one observation. In that we are using what rating scale, checklist, anecdote, videotapes, then closed circuit TV. The next one you are using what biophysiological method. In that in vivo biophysiological method and in vitro biophysiological method. Then other method we are using projective technique, Q shot and vignettes. Next slide. So interview method of the what data collection means it is an conversation between two people, interviewer and the what interview means researcher and the respondent. So interview method is a what method of data collection in which one person interviewer asks the question from the what another person respondent, which is conducted either face-to-face interview or telephonically. So nowadays many researcher they are using what telephone method of the what interview method of the data collection. An interview is a what conversation between two or more people, interviewer and interview, where question are asked by the interviewer to obtain information from the what interview. So we'll call as a interview method of the what data collection. Here nothing, their researcher and the what respondent will be there. So next one, characteristics of the what interview method of the data collection. First one, the participant, the interviewer and respondent are what stranger, they don't know before. The second one, the relationship between participant in what transitory one. The interview is a mode of obtaining verbal answer to the what question put verbally. Then third one, the investigator record the what information. So in qualitative study, any information from the respondent, the researcher what they're recording. The interview can be conducted over telephone also. The next point, it is not always limited to a what single respondent. Then it is not standardized process. It can be modified according to what situation. So you're using what different types of the what interview method of the data collection. Next one. So next one, benefits of the interview. So what are the main benefits of the what interview method of the what data collection? First one, it provide in-depth detailed information. Then second one, it permit greater depth of the what responses means you can ask in detail about the what information, and we can collect data from the what illiterate subject. The next one, high response rate. It clarify the what misunderstanding. So during what interview session, if there is any if they are not understanding any misunderstanding, we can what clarify during the what interview session. Ask question at what several level helps to gather other supplementary information and useful for the what special devices, flexible and adequate for people who are unable to write their responses. Interview is the what important for the what. These are the main benefit of the what interview method of the data collection. Next slide. So next one, types of interview. So you are using what different types of the what interview method of the data collection. First one, structured interview. Structured interview matlab the directive interview means here the researcher they will collect the what the researcher they are having set up questions. So before asking to the what respondent, so we'll call as a structured interview. Second one, unstructured interview means non-directive interview. Matlab a non-standardized interview. Here the question can be changed to meet the what respondent intelligence. So we'll call as a unstructured interview. The next one, semi-structured interview means it is a flexible method that allow new question to be brought up during the what interview session. So we'll call as a semi-structured interview. The next one, in-depth interview. In-depth interview matlab we are using mainly in the qualitative study. We are asking respondent in-depth knowledge about the what particular phenomenon. The next one, focus group interview. This one also we are using in qualitative study. There is a 8 to 10 members respondent will be there. So you are asking their what opinion about the what these questions. So you will call as a focus group interview. The next one, telephone interview. So nowadays we are using what many researcher to collect the information through the what telephone interview method. So these are the what the main types of the what interview method of the data collection. Next slide. So next one, advantages of the what interview. So it is useful to obtain information about the people feeling, their perception, their opinion. It allow more detailed question to be what asked, high response rate to be achieved from the respondent. The respondent own word are what recorded. Ambiguity can be what clarified means any misunderstanding anything you can clarify with the face-to-face interview. The meaning of question can be what clarify if they are not understanding during the interview session we can clarify the what questions. So these are the what the main advantages of the what interview method of the data collection. Next slide. Then some of the disadvantages of interview method of data collection. It is time consuming and costly because you cannot do the interview method of data collection large sample size. Then high degree chance of the what interviewer bias. So these are the what the two disadvantages of the interview method of data collection. Next slide. The next one, questionnaire method. So we are using what questionnaire method of the what data collection. So the questionnaire method matlab it is a structured instrument consist of the what series of question set of question prepared by the what researcher. That researcher subject is asked to what complete or gather data from the what individual about their knowledge, their attitude, their beliefs, their feeling, their ideas. So we will call as a questionnaire method of the what data collection. So questionnaire is what structured self-report paper or pencil instrument that research subject is what asked to complete. So we'll call as a questionnaire method of the what data collection. Next slide. So we are using what different types of the what questions. The first one, open-ended question means the open-ended question are those questions which provide opportunity to the respondent express their opinion, their feeling, answer in their what own way. So we'll call as a open-ended question. So the example is there. Next slide. So open-ended question. Tell me about your relationship with your friend. So what happened at the meeting? How do you get work? Means go on explaining. There is no this one. So this type of question we'll call as a open-ended questions. Next slide. Next slide. Next slide. The next one, close-ended question, means these questions offer respondent number of alternative replies from which the subject must choose most likely matches to what appropriate answer. Close-ended question refers to any question for which researcher provide research participant with option from the what which to choose the responses. Means there is a one question, four distractor will be there. So which one is correct? You have to what choose. So this type of question you will call as a close-ended questions. Next slide, example. So the dichotomous question means these require respondent to what? Make choice between two responses such as yes or no or true and false, male and female. Example, have you been hospitalized? Yes or no. Please enter your gender, male or female. So this type of question you will call as a dichotomous question. The next one, multiple choice question, means these questions require respondent to what? Make choice between more than two response alternatives. So we'll call as a multiple choice question. Means there will be one question for distractor will be there. In that you have to select correct one. So example is what? What is the basic functional unit of kidney? So renal cortex, nephron, glomerulus, renal medulla. So you have to select the correct one. Second one, who is known as Lady with Lamp? Mother Teresa, Sarojini Naidu, Florence Nightingale, none of these. So Florence Nightingale. So like this type of question we'll call as a multiple choice question. Next slide. The next one, cafeteria question, means these are the special type of multiple choice question that asks respondent to what? Select response most closely corresponding to their view. So this type of question you will call as a cafeteria question. Means example, people have different view on family planning. Which of the following best represent your view? Means it is necessary for quality of life, it is immoral, should be totally banned, it is undesirable side effect that suggests need for the caution, it is immoral, should be what practiced. So this type of question you will call as a cafeteria question. Next slide. The next one, rank order question. Next slide, please. Next slide. So rank order question. Bridges, next slide. So rank order question means these question ask the respondent to rank their response from most favorable to the what? Least favorable. So you have to give the first priority. So this one you will call as a rank order question. Example, according to you, most important your life. Rank from most favorable to the least favorable. Money, education, family, health. हाँ, उसमें कौन सा आपका the best priority है? So this type of question you will call as a rank order question. Next slide. The next one, contingency question, means the question that is asked further only if respondent give particular response to the previous question. So this type of question you will call as a contingency question. Example, do you have children under 18 years at home? No means no need to ask. Yes, please list the ages. The second example, did you buy anything in the hotel shop? Yes. Then ask further. No means no need to ask. So what do you buy in shop? Clothes, stationery, other toys. So this type of question we'll call as a contingency questions. Next. The next one, rating questions, means these questions ask respondent to what? Judge something along an order dimension. The respondent asked to rate particular issue on a scale that ranges from poor to good. They may provide number of what? Choice. Best example, how do you rate the following? Very poor, poor, okay, good, very good. So this one, this type of question you will call as a rating questions. Next slide. The next one, importance question. In this, respondent asked to rate importance of particular issue on rating scale 1 to 5. This helps to know that things or issue that important to a what respondent. For example, exercising every day is dash for the health. So you can rate, you can give numbers 1, 2, 3, 4, 5. One stand for the extremely important, very important, somewhat important, not very important, not at all important. So this type of question you will call as a importance questions. Next slide. The next one, Likert questions, means it helps to know how strongly respondent agree with the what particular statement. This question helps to assess how respondent feel toward certain issue or services. Example, person with multiple sex partner is high risk for the what AIDS. So strongly agree, agree, uncertain, disagree, strongly disagree. So this one you will call as a Likert type questions. Next slide. Bipolar questions means the question that have two extreme answer. The respondent had to mark his or her response between the what two opposite end of the what scale. For example, what is your balance of preference here? I like going for a walk. I like watching movie. So this one you will call as a bipolar questions. Next slide. The next one, matrix question, means it include multiple questions and identical response. Categories are assigned. The question are placed one under the another. So forming a matrix, the response categories are placed under along the what? Top list of the question down the side. So example, how satisfied or dissatisfied are you with following the attribute? Very satisfied, satisfied, neutral, dissatisfied, very dissatisfied. So next one, next slide. So method of questionnaire administration. So you are using what? Different methods of the what? The questionnaire administration through the postal, through the telephone, through the electronic sending mail, or personalized administration through the telegram, through the WhatsApp. So you are using what? Different methods of the what? The questionnaire administration to the respondent. Next slide. So what are the advantages of the what questionnaire? It is cost effective, easy to analyze, less time and energy to administer. It reduces the bias. You can use for the what large sample size. So there is a 500,000 to 2,000 sample size. You can go for the what questionnaire method of the data collection. So interview method, we cannot go for the what large sample size. The next one. So some of the disadvantages of the what? The questionnaire method of data collection not suitable for all. Means illiterate होते ना उनको हम questionnaire method of data collection नहीं कर सकते हैं. Then low response rate. It is sent by mail by filled by the what someone. It provide only what superficial information. Then there is a what chance of the what misinterpretation. The people can lie and answer the question vaguely. So these are the what some of the disadvantages of the what the questionnaire method. Next one. The next one, composite scale or attitude scale, means the composite scale is a socio-psychological measurement which are directed towards the what quantifying the qualitative attributes such as their feeling, their attitude, their self-concept, their perception and beliefs. So this one you will call as a composite scale or socio-psychological measurement. Attitude scale is a what? Special type of questionnaire designed to what? Produce score indicating the intensity and direction of a person, their feeling about the what? Object or event. So we will call as a attitude scale. Next slide. The next one, Likert scale, means Likert scale developed by the what? Psychologist Rensis Likert, 1932, as a psychological concept measurement scale. The scale developed to measure the what? Attitude, values, feeling of the what? Respondent. The primarily origin version of this scale is what? 5-point scale, strongly agree, agree, neutral, disagree, strongly disagree. But some of the researcher, they may use for the what? 7-point scale also. So according to what the researcher interest. Next slide. So what is Likert scale? Likert scale is a what? Composite measurement of the what? Scale used to measure the what? Attitude, feeling, values of people that involve summation of score on the set of positive and negative declarative statement regarding what? Measure variable to which respondent are asked to indicate their degree of agreement or disagreement. So this one you'll call as a Likert scale. Next slide. So uses of Likert scale. So where you will use in research this Likert scale? The scale used to measure the what? Attitude, values, the feeling of people about the what? Specific concept such as their situation, people, places, object, program, practices, policies, and so on. It may also use it to assist the what? Opinion about the what? Respondent. For example, the patient care in the hospital. So after discharging, before discharging, they may provide how you feel about the what? The nursing care services in the hospital. This scale used to have quantified measurement of the qualitative attribute of the people, their feeling, their values, and their beliefs. So these are the what? The main use of the what? Likert scale. The next one, the Likert scale example, agreement, strongly agree, neutral, neither agree nor disagree. Disagree and strongly disagree. So like this, we can make the what? The Likert scale. Next slide. The next one, likelihood, very likely, neutral, not likely, very unlikely. So you would be recommended this product to what? My friend. So next one, satisfaction, very happy, somewhat happy, neutral, not very happy, not at all happy. So this type of you will call as a Likert scale type of questions. Then importance, very important, or important, moderately important, slightly important, not important. The next one, semantic differentiation scale, means the semantic differentiation scale is a 7-point rating scale used to derive respondent attitude towards the what? Given object or event by asking him to select appropriate position on a scale between two bipolar adjectives such as warm, cold, powerful, or weak. So semantic differentiation scale is a type of rating scale designed to measure connotative meaning of object, event, and concept. These connotations are used to derive respondent attitude towards the what? Objectives, event, and concept. So this one you will call as a semantic differentiation scale. So you are using what? Rating. The use of semantic differentiation scale, patient satisfaction survey, customer satisfaction survey, employer survey, marketing survey, personality measurement, and clinical psychology. So in this, we are using what? The semantic differentiation scale. Next slide. Next slide. The checkout process was what? Straightforward, strongly agree, undecided, disagree, strongly disagree. So semantic differentiation scale, check out the process was. Is straightforward or confusing. So this is the example for the what? Semantic differentiation scale. So example of the what? Semantic differentiation scale assist the belief about the what? HIV/AIDS. So we can give the what? Proper this one, the point to the according to scale. The next one, disadvantages of the what? Semantic differentiation scale. So it is a next slide. So it is a convenient method to assess the what? Beliefs, attitude, and values of the what? Quantitative form. Then the second advantage is easy to administer. It provides reasonable, valid, and reliable quantitative data. So these are the what? The main this one advantages of the what? Semantic differentiation scale. Then disadvantages, lack of standardization of the tool, time consuming to find the appropriate adjective pair. So these are the what? Some disadvantages of the semantic differentiation scale. Next slide. The next one, visual analog scale, means the visual analog scale is a what? Psychometric response scale that is used to measure the what? Intensity of certain sensation, feeling such as pain, discomfort, anxiety, stress, quality of sleep, severity of clinical symptoms, functional ability, attitude towards the what? Environmental condition. This has 10 centimeter line and the end mark semantic what? Opposite. So you will call as a visual analog scale. Best example is what? Pain scale. Next slide. So this visual analog scale is a tool that is used to assist a person rating the intensity of certain feeling and sensation. So the visual analog scale is a bipolar scale that is used to determine degree of stimuli the patient experience. One side of the scale express the what? Absence of stimuli, while other express the what? Presence of stimuli. So the best example is what? The pain scale, stress scale, distress scale. So these are the best example for the what? Visual analogy scale. Next slide. So you can see here the distress scale. So under 0 to 10, undesirable distress. Then 0 means what? No distress. So like that, the best example for the what? This visual analogy scale. Next one. So you can see the what? Pain scale 0 to 10. 0 means no. 1 to 3 means what? Mild pain. 4 to 6 means moderate. 7 to 10 means what? Severe pain. So we can use for the what? The assessing pain of the what? Patient. Next slide. The next one, observation method of the what? Data collection. Means the word observe is derived from the what? Latin word observe, which means what? To notice. The observation is a technique for the what? Collecting the data or acquiring information through the what? Occurrence that can be observed through the what? Sense with or without mechanical device. It is a two-part process to collect data of the what? Study that include observer, someone who is what? Observing, and observed. There is a something to what? Observe. So this one we will call as a observation method of the what? Data collection. Means the researcher, he may involve in the what? Study subject and he can what? Observe. Or partially outside he can observe the what? Respondent. So this one we will call as a observation method of the what? Data collection. Next slide. Use of observation method of data collection to understand ongoing process or situation. Second one, to gather data on individual behavior or interaction between people. Third one, to know about physical setting. The last one, the data collection where other method are what? Not possible. So these are the what? The main uses of the what? Observation method of the data collection. Next slide. So types of the what? Observation method: structured observation, unstructured observation, participant observation, non-participant observation. So we'll see one by one. So what is structured observation? So in this method, the researcher prepares structured or semi-structured tool in advance to observe the what? Phenomenon under study. This helps the researcher to be on track while carrying out the what? Observation, while carrying out the what? Research, as well as analysis of the what? Data collected during what? This method of the what? Observation remain what? Easy. So using this structured observation, checklist, rating scale, and category system. Sorry. The next one, unstructured observation, means this method is generally used in what? Qualitative study, where observer is made with what? Minimally structured. It is used for complete non-specific observation of the what? Phenomenon, which is very well known by the what? Researcher. So log, field note, anecdotal record, field diary, video recording. So this type of you will call as a unstructured observation. Next one. Next slide. The next one, participant observation, means the historically field and ethnographic researcher have been associated most strongly with the what participant observation, where observer may live or work in the field, actively participated in ongoing activities for an extended period. For example, logbook, field note, field diary, tape, video recording. So this one you are using for the what participant observation. The next one, non-participant observation, means in this type of observation, the observer work as a what? Eavesdropper, where attempt is made to observe people without interacting with them. So this technique that observer is not a participant in setting, but merely viewing the situation. People are observed without their knowledge that they are being observed. For example, researcher, they are not involving with the what respondent, but the through outside they can easily what observe. So this one you will call as a non-participant observation. The next one, other categories, narrative observation, example, field note, anecdote, sample observation, rating scale, checklist, event sampling, time sampling, and technology assisted observation, photograph, videography, audio tapes you can use, you can record the what observation. So this type of this one you will call as a observation method of the data collection. The next one, field note, means the field note is a what qualitative note of the what observation made by the researcher in a research setting, in which descriptive reflective narration of the what observed behavior, event, place, person. It may even including sketches, diagrams, drawings. Descriptive information is what actual data that is being recorded, including time, date, physical setting, social environment, description of the subject being what studied and their role in the setting, and impact that observer may have had on the what environment. So this one you will call as a field note of the what observation method of the data collection. The next one, anecdotes, means it is a brief non-judgmental written record of the what observed incident. The anecdote or record what, when, where, how event happened, what was said and done. The anecdotal record is a short, objective, descriptive summary of one event, incident writing down after the event has been take place. So this one you will call as a anecdotal observation method of the data collection. The next one, rating scale. So rating scale means it is a term used to express the what opinion, judgment regarding the what some performance of the person, object, situation or character. Rating scale is a tool in which one person simply check the what another person level of performance. So you are using what the rating scale. This one could be 3-point scale, could be 5-point scale. With some researcher they may use for the what 7-point scale also. So we are using different types of the rating scale: graphic rating scale, descriptive rating scale, numerical rating scale, and comparative rating scale. So in that first one, graphic rating scale means it is the simplest and most popular method of the what appraising the performance. In this scale, the performance is printed horizontally at various points from lowest to the highest. It including numerical point on the what scale, means 0 to 10. Likert scale is a popular what graphic rating scale. For example, to what extent the staff nurses participate in the what clinical conference? Never, seldom, occasionally, frequently, always. So this type we will call as a graphic rating scale. Second one, descriptive rating scale. So descriptive rating scale matlab in this type of rating scale does not use number but divide the assessment into what series of verbal phrases to indicate level of the what performance. The best example is what judge the level of performance of the what nursing personnel in the what medical ICU, means the staff nurses who are working in the ICU. So their performance, clinical performance you have to check. So that type of you can use what descriptive rating scale. Next slide. The next one, numerical rating scale, means this is a scale. Each statement is generally assigned a numerical score ranging from 1 to 10 or even more. It divides the evaluation criteria into fixed number of points. Visual analogy scale, semantic differentiation scale can be presented using the what? Number rating scale. For example, best example is what? Pain scale. So 0 to 10. So mild, moderate, severe pain. So the best example for the what? Numerical rating scale. The next one, comparative rating scale. So this type of rating scale, the researcher make a judgment about the what? Attribute of a person by comparing it with that of similar another person. So the comparative study we are using what? Comparative rating scale. The advantages of the rating scale, it can be used for large number of subjects, maybe 200 sample size, 300 sample size, easy to administer and score, efficient, economical in term of time and money. It helps to reduce the what? Unreliability. It is used to evaluate performance and skill of the what? Person. So these are the what? The main advantages of the what? Rating scale. The next, some of the disadvantages, it is difficult to fix up the what? Rating about many aspects of the individual. Misuse can result in the what? Decrease in the what? Objectivity. So these are the what? Some disadvantages of the what? Rating scale. The next one, checklist. So you're using what? The many checklist, for example, in OSCE examination. So you're using what? Checklist for assessing the what? Student performance on the procedure. So checklist is a what? Simple device consisting of what? Prepared list of items which are thought by the what? Researcher to relevant to the what? Problem which is being studied. The checklist consists of the what? List of items with a place to check or mark or yes or no. So checklist is a what? List of all the things that you need to do, information that you want to find out, or things that you need to take somewhere, which make in order to ensure that you do not forget what? Anything. So this one you will call as a checklist. So some of the characteristics of the checklist: observer, one respondent at one time, then use only carefully prepared checklist to avoid more complex what? Difficulties or trait. The observer should be trained how to observe, what to observe, how to record and observe behavior. The best example is what? OSCE examination. The construction of the checklist. How you can construct the what? The checklist. Express each item clear, simple language. List of the item in checklist may be continuous or divided into group related item. Third one, avoid negative statement wherever possible. Ensure that each item has clear response, yes or no, true or false. Review the item independently. So these are the what? Some point you have to remember while formulating the checklist. The three essential type of checklist: procedure checklist. They are using what? Any procedure, hand washing or rails tube insertion. You are using what? Checklist only. Communication checklist encourage what? Communication in organization. Project checklist list tasks that must be what? Completed. So this type of the types of the what? Checklist we are using. So this is best example for the what? Checklist. Next slide. The procedure checklist for the what? Hand washing. Next slide. The another checklist for what? Admitting a patient to a what? Nursing unit. So these are the what? Medical hand washing, rails tube insertion. So these are the what? You are using different this one, the checklist for the what? Assessing or about the what? Procedure or about the patient care. The next one, advantages of checklist. Next slide. So there are advantages of checklist. They can be developed very easily, quickly, relatively less expensive. Their design can be highly specific and adequate. Checklist reduce the chance of error in observation. It is useful to obtain large amount of data. It saves the time. It is useful in evaluating learning activities. It helps in evaluating procedure work. It has objectivity in evaluating the what? Characteristics. So nowadays, first year BSc, we are using what? The checklist. Disadvantage of checklist does not indicate quality of performance. So usefulness of the checklist is what? Limited. It is very easy for certain important item to be omitted in the what? Checklist. So these are the what? Some disadvantages of the what? Checklist. Next slide. The next one, biophysiological method, means some of the instrument we are using what? To collecting the what? Information from the what? Respondent. So if you are doing RCT research, randomized control trial, so in that time you are using any instrument. So this type of studies we will call as a biophysiological method, means it involve collection of the what? Biophysiological data from the what? Subject by using the what? Some of the specialized equipment to determine the what? Biological and physiological status of the what? Subject. For example, you want to assess blood pressure of the patient, you are using what? Sphygmomanometer. The purposes of biophysiological method, the study basic physiological process, to study physiological outcome to the nursing care, to evaluate the nursing intervention, to study correlation of physiological functioning with what? Patient problem. So these are the what? The main purposes of using what? Biophysiological method. The next one, types of biophysiological method. In vivo biophysiological method and in vitro biophysiological method. Next slide. So in vivo biophysiological method and in vitro biophysiological method. In vivo means outside this one. So for example, taking blood pressure. In vitro means what? To assess the patient condition. For example, antenatal mother. So you are using what? USC to see the condition of the what? Baby. So in this in vivo biophysiological method, in this method, measurement are directly performed over the what? Organism or study subject using what? Specialized equipment. Example, measurement of the BP by using sphygmomanometer, cardiac conduction using what? ECG machine, temperature using what? Thermometer, and oxygen saturation using what? Pulse oximeter. The next one, in vivo measuring instrument system involving what? 6 components: stimuli, subject, sensory equipment, then signal conditioning, display equipment, and recording equipment. So physiological measurement are the what? Good example for the what? In vivo and biophysiological measurement, temperature and blood pressure. Then in vitro biophysiological method means the measurement of the what? Biophysiological attribute of the subject, which is carried out through the what? Collection of sample of the data related to the what? Physical, biochemical, microbiological, pathological, and anatomical status by using some technical instrument, sending them to laboratory for their analysis and interpretation. So best example, you see the patient, this one, the cancer cells, we are sending biopsy to the what? Laboratory. So in vitro biophysiological method, measurement are carried out outside the organism by using the what? Specialized equipment. So this one you will call as a in vitro biophysiological method. Next slide. So you're using what? Different, this one for the what? The radiological measurement, evaluation of the what? Body tissue by using what? X-ray, CT scan, and MRI. Biochemical measurement, you are using what? Biochemical attributes such as serum electrolyte, blood sugar level, liver function test, complete blood count test. Then microbiological measurement, these including evaluation of the what? Bacterial count, culture, sensitivity test of the urine, blood. So these are the what? The main in vitro biophysiological method you are using the what? Assessing the condition of the what? Patients. Next slide. Cytological measurement. So the detailed examination of the cytological attribute. Example, fine needle aspiration of the what? Breast tissue or tissue biopsy or lumbar puncture test. So some of the disadvantages of biophysiological method. So measure relatively what? More accurate and errorless. It provides valid measurement of the what? Targeted variables. Easy access to what? Most of the what? Instrument. So these are the what? the main advantages of the what biophysiological method. Some of the disadvantages, some of the instrument are what very expensive. Example, CT scan, MRI, require training, knowledge, and what experience. The result produced by the biophysiological measurement instrument may be affected by the what environment. The fear, anxiety among the what participant. Some biophysiological method may have harmful effect on the what participant. So these are the what some disadvantages of the what biophysiological method data collection. So these are the what the total about the what tool for the what data collection. So you're using what different tool for the what data collection, interview, questionnaire method, observation method, rating scale. So it will helpful for the what the proper data collection during the what research study. So if you have any doubt, you can ask the question. Hello, ma'am. Yes, ma'am. Hello. Yes, ma'am. Hello, ma'am. Brijesh. Hello. Hello, ma'am.
Yes, ma'am. Hello.